Get started. Thanks for everybody that's called in for joining today. I know it is Easter weekend, so we appreciate you taking the time here today. My name is Quirk. I am the Director of Development and Analytics at CareOptimize. I'm also in charge of the Strategic Initiative. And today we'll be going over some free utilities that we offer on our EHR Utilities website. So our website where you can access these is ehrutilities.com. And the way that this website came about is a somewhat interesting story. We've essentially compiled interesting utilities that we thought would help other people out that we've developed for clients over the years. And also where we see gaps in the market, we've tried to develop specific utilities to address problems that are happening with NextGen and our other EHR systems that we're working with. And we release products from time to time to address those issues. So on the website, ehrutilities.com, we have free and paid utilities. Today, I'll be going over our 3 most popular utilities, but there are other ones out there. We're going to be going over the free utilities. We also have EHR agnostic utilities. So these are utilities that will work on whatever EHR system you're on. We have some non-EHR related utilities. These are just things that we've developed for Outlook, for our time tracking system that we use, that other people using those platforms may enjoy using. Sorry, I am moving my thing. And lastly, we'll be talking about our free state of the practice evaluation, which is a little bit different than the other utilities that we offer, but I will get to that in a later slide. So as I mentioned, we'll be going over our 3 most popular utilities today. Those are the Clinical Operations Management Template, the Document/Care Guideline Autocomplete Package, and the State of the Practice Report. So the first one that we're going to be going over is the Clinical Operations Manager. So the Clinical Operations Manager is a template that is used to manage your practice on an enterprise-wide level. So this is used to give your administrators the high-level overview of things that are outstanding, things that are assigned to people, and any inefficiencies in your system. So it allows you to monitor clinical tasks, patient portal messages, PAQ items, open orders, unmatched refills, undocumented encounters, unbilled encounters, and then items stuck in your Rosetta holding tank. So this is a practice template, being that we're monitoring things on an enterprise-wide basis. We designed this so we could launch this and view data across the entire practice. So you don't have to open up a specific patient, navigate, to whatever area you need to. This is just one template that you can open easily from your system practice template area, and you can go ahead and see the data for your practice. It's filterable by type, user, location, and depending on which item that you're looking for. In my next slide, I'll be showing the actual template, but whatever parameters are associated with whatever item you're looking to monitor, it will have different parameters to filter by. One nice thing about this utility is you can also reassign tasks in bulk. So I mentioned in my previous slide that clinical tasks is one of the items that we'll be monitoring with this template, but we also have the option in the clinical task area to go ahead and reassign the tasks on a large scale at once. So if you have people that have left your organization and you need to assign those tasks, they've been stuck in their inbox for however long they have been, you can go ahead and assign those to a different person on your team and go ahead and have those outstanding items addressed. So this is an overview of the template. As you can see, it's split into the different categories that I mentioned in my previous slide. Each area here is filterable by either user type, location, provider, whatever is relevant to that particular item. In the bottom grid, it will show you the actual data associated with the outstanding items that you have. So you can click on these different areas and it'll allow you to view all of the clinical tasks, patient portal messages, PAQ items, whatever it is that you're trying to monitor, and it'll go ahead and show you all those items with the user that they're assigned to, subject, description, and depending on what you're looking at, these columns will change to have relevant data to the items that you're looking at. You can then go ahead and filter it by users, or you can go ahead and filter it by type. And as I mentioned, in regards to the tasks, to reassign the tasks, you can go ahead and reassign any outstanding tasks to a particular user. If you had, the scenario I mentioned before, where the person working for your organization left and you want to go ahead and assign those tasks to different users. Now, this is a really easy to install template. I'm going to be touching on how the install of some of these things work. You can request this on the ehrutilities.com website, and we will go ahead and send you, we'll get an email from the website saying that you've requested this item. We'll go ahead and send you the templates to install. In this particular one, all you need to do is go ahead and install with stored procedures, and then upon the first load of the templates in your system, you're going to want to hit this initialize and recalculate, which will load the data in the template. So don't really have to be a developer for this one. You just need to know how to use the template import export utilities. And once you've gone ahead and loaded it, you found it in your practice template section, all you need to do is, on the first time, is hit this initialize and recalculate button, and it will go ahead and load the data there. Now, this is pulling data from a lot of different portions of the system. It will not slow down your production environment, but upon the first load of this, it may take a couple minutes to go ahead and populate all of the different grids here. So normally when we hit that initialize and recalculate button for the first time, it normally takes a minute or two to get everything populated and everything in their respective grids. I'm just trying to give everybody some insight on the install and how the setup of this template works. And we'll be opening up to questions at the end. So at the end of this presentation, if you have any specific questions on anything, I will have my team member on the line unmute you, and we can go ahead and ask questions and address those items. So the next free utility that we'll be going over today is the document/care guidelines management utility. And this is a really interesting utility. This is by far our most popular free utility. And what this does is it allows you to go ahead and, upon scanning of an image into document management, it can actually autocomplete either your care guidelines or the open orders for a particular item. So it's separate packages. You can either install just the document autocomplete utility or just the care guidelines utility. It removes the need, as I mentioned, to manually go into order management or the care guidelines section and go ahead and update those status. So it does take a little bit of a burden off your team that when they're getting in, the results for their lab tests, they don't need to go to order management and go ahead and close that order. It's going to go ahead and mark that order as results received automatically. So it cuts down on the amount of time that your workers are going in the system and manually updating things. Now, this particular template is in a 5984 beta mode. We have a 5883 version that has been working great. When NextGen upgraded to Care Guidelines 2.0, it broke all of the triggers associated with our utility. So in collaboration with one of our clients that had this utility and working with NextGen, we were able to get a working version that works on Care Guidelines 2.0. It has passed our quality control process by the developers, but it currently isn't in widespread release, and we are releasing this today for those that do want this package. So I would suggest working this one in a test environment. We never know how things are going to work out until we get widespread testing on this. It has passed our testing, but if you are interested in this utility, and a lot of people, as I said, it's our most popular free utility, certainly request it. Go ahead, install it in your test environment. If you notice any issues, go ahead and reach out to us. We'll get them fixed. And through your testing, we'll be able to create the best utility possible. There is some trigger knowledge needed for this. So while I mentioned with the Clinical Operations Manager template that it's just a quick install with stored procedures, this particular template does require a little bit of development knowledge. Now, if you need assistance, if you don't have a template developer on your team, we can certainly assist with this. But if you do have a development person on your team, we do have instructions on how to set up the triggers necessary to install this template. So how this works, in regards to the document management utility and the care guidelines utility, there is an install process, but there also is a manual mapping that will need to be done by your team. So how this works is we have these system templates in here. You would go ahead and define the document type. So in ICS, or document management, essentially what we're going to say is for this document type, when it is scanned in, I want this test type, so this order, to be completed upon scan in of that image. The document reference field down here, this can be configured to whatever parameters you have set up in document management when you're scanning in. But the most common thing that I see is people using data service for this. So when you're scanning an image into document management, you go ahead and place the order date of the mammogram, for example. We've gone ahead and outlined the document type. So if I were to have an open mammogram order and I scanned in a document for the medical history document type, and the data service correlates with the date that the order was placed, it will then go ahead and mark my mammogram order in order management as results received. And that can be configured to be completed if you'd like to, but it does take some additional development. The care guidelines utility is very similar in the same sense. So what we are outlining here is what kind of document we'd like to go ahead and close a particular care guidelines gap. So it works the same way. We go ahead and outline the document type, the protocol that we'd like to go ahead and close the particular care guideline we'd like to close. And upon scanning in a care guideline or in a document, it will then go ahead and close that care guideline for you. So this is just an example of the setup that happens in document management. If you're familiar with this screen, if you do any scanning of documents, you likely are. So in this particular example, if I was trying to close this care guideline gap or this particular order, I went ahead and scanned in my medical history document type, which you saw in the previous slide. I'm associating it with a particular person, and then if the date of service correlates to the date that the order was placed for this, or if you have the care guidelines set up, if the data service will then be used to mark the care guideline as complete and put in that data service. But upon scanning of this document, it's going to go ahead and complete your order management order, or go ahead and complete your care guideline loop. So it eliminates the process for you to go in and have to go update those things manually, which cuts down the amount of the time that your workers need to be doing this and enables you to be more productive in your workspace. As you can see, it's going to go ahead and mark your orders as results received. And if it was a care guideline, it's going to go ahead and mark it as completed. So the last utility that I'm going to touch on today is the state of the practice report. So the state of the practice report is a little bit different than the other utilities that we offer on ehrutilities.com. It allows you to evaluate your practice by over 25 different metric types, and I will go through each one of those metric types here in a moment. But it is a proprietary report. So this is not something that we send out to clients. If you do request a state of the practice report, we will set up a time to do a WebEx with you where we'll go ahead and run the report. We all are pulling data from a lot of different portions of your system. So normally what I advise here, because there is the risk of slowing down your production environment, is if your Crystal reports are set up to run against the report server, we can go ahead and pull the data that way. But if you do not have that set up configured in your environment, we normally advise this one to go ahead and be ran after hours or when people aren't on the system, so that it's not slowing down, pulling all of this particular data. The one other way that this changes is once we've gone ahead and run the report, we go ahead, install it, run it on your system, and then it will be removed because it is a proprietary report. But then we'll actually go ahead and schedule an additional meeting with you where we're going to go over these metrics with you and make suggestions on the things that you can do to improve your practice, and any deficiencies that are identified in those reports. We'll sit down and talk with you about them, about how you can improve those things. And both the running of the report and the consultation on evaluation are all free. So normally the report takes about 20 minutes to run, depending on the performance of your system and the amount of data in there. And then we normally do about an hour-long free consultation and evaluation. So it's really a good way to get another party's eyes on the health of your practice and identify any gaps that you may have and get suggestions on things that you may be able to do to improve your processes. So I'm just going to go ahead and go through the different metrics that are in this report. This is what it looks like. So the first area is the active contracts. So if you have active contracts loaded in your system, it's going to go ahead and show you all of the ones that are currently active in your system. The BBP Jobs List, so this is showing all of the jobs in your BBP the last time that they ran, and if that last time that they run, if they were successful. So this is useful for identifying things in your BBP that may be failing for whatever reason or may not be running, and go ahead and address those issues and get those things fixed. Next, we have the licensed providers. So this is pulling from your file maintenance. It's going to show you all of your providers and the type of licensing that they have. This is good for if you have providers leaving the practice. You may be paying for a license that's not being used. So it's always good to know exactly what you have there so you can have those talks with NextGen if you need to and reduce the amount of licenses that you are paying for. Next is the AR aging report. So this is going to show you the outstanding accounts receivable by your plan. So we have the amount that is an outstanding for 0 to 30 days, 31 to 60, 61 to 90, and over 90 days. At the bottom here, we have these little dials that give you a visual description of your outstanding items, and the benchmarks, as you can see, suggested to have a certain percent for the 0 to 31 category, a certain percent for the other categories as well. And then it also does tell you what the amount outstanding is and what the average benchmark and what percentage by plan is falling into each of those different AR categories. So very useful report, a lot of interesting data that you may or may not be aware of that's happening with your receivables. So next is the bill lag time. That's the average amount of time that's elapsed since the date of service and the first bill date for that encounter for the last 30 days. So this is good for monitoring people on the EPM side, seeing how long it's taking from the encounter happening to the charges actually getting billed out. And it's going to give you an average amount of days that your system, that your billers are taking to get the claims out the door. The benchmark for this particular one is 3 days. So this particular one that we ran it on is 2 days, but it gives you an idea of what the standard is and what you should be striving for. Next is charge entry lab time. So this is the amount of time that has lapsed since the date of service and the first charge entry for that encounter for the last 3 days. This is broken down by encounter. So it goes ahead and shows you, or by provider, shows you on a provider basis the amount of charges, the longest time that it's taken for those charges to get in, and then the average lag time. So next we have the denial rate. So this is the different denials and broken out into what the causes of those denials are. So we have benefit eligibility, coding, additional info required, authorizations or referrals, and credentialing. And then we do have this nice little pie chart down here at the center to go ahead and provide a visual description of where your denials are coming from. Next, you have your top 20 payers, the total transactions, and the total amount you receive from those payers. So it shows you all of your different payers, who is your most engaged payer and you're receiving the most revenue from. And it does have a nice little pie chart, again, showing you the breakdown of your payers and how much of an impact those different ones are having on your practice. The unapplied credits, so this is the total amount of unapplied credits still existing at the encounter or account level. So it's going to go ahead and show you the transaction, the oldest entry, and the total amount of that oldest entry. Next is the average appointment per day by provider. So this is a good productivity report for monitoring your providers, seeing how many patients they're seeing a day, seeing how many appointments that they have on their calendar, and the total of no-show visits that they're having for each provider. So it is a good thing for both monitoring your providers and their productivity, and then also identifying areas where you're getting a lot of no-shows for particular providers and finding a way to negate that issue and get those providers with a lot of no-shows to maybe reach out to the patients and make sure that they're getting into the clinic. So the next metric is the first third appointment by resource, which is a kind of a strange practice. So this is a benchmark that I believe it was CMS has defined as a way to go ahead and evaluate your provider's availability. So how this works, it goes ahead and looks at the appointment book and finds the third open time slot for your provider, and then the lag time between the current date and their first or their third open time slot. So the way that this benchmark was defined is that the first and second time slot, by whatever metrics this was used for, whoever created this, can often be disregarded as, you know, just a potential gap in scheduling, an issue where somebody didn't put it in. But the metric that this is surrounding by says that the significance of your provider's availability is actually dependent on the third open time slot for that particular provider to go ahead and reduce data discrepancy from, you know, potential time slots that are free for whatever reason. So the third open time slot, it shows you what the third open time slot is and the amount of days till that. This is good for monitoring provider load. So if they have a lot of days till their third open time slot, that provider is having a lot of bookings. If they have a small number till their third open time slot, it means that that provider has some availability and could likely be booking patients more frequently. PM task not completed. So this is kind of ties into the clinical operations manager. You could use these jointly, but this is the amount of PM tasks that have been created by user, the amount of total tasks that are outstanding, and then the oldest outstanding date. So this particular practice that we ran it on has, as you can see, a good amount of outstanding PM tasks. You can see 15,000 right there with this first dummy patient that we have, and they date back all the way to 3/8/2017. So the way that I would approach this, if we ran this state of the practice report, the clinical operations manager is the perfect utility to go ahead and clean this up. If you have a situation like this and we run this for you, you can then use the clinical operations manager utility to take the PM task not completed out of this Michelle Black's queue and go ahead and to assign it to somebody that's going to be working those tasks. So this is a way to go ahead and monitor the productivity of people working on the PM side and see how many tasks that they have outstanding by their different assignees. Next is kept appointments with no charges. This is an overview of encounters created with no charges for the last 12 months. So as you can see, it's breaking this down by location, resource, and event, and then it shows the amount of encounters where there was no charges associated with them. Next is a MIPS quality section. So if you did have the CQM check template configured, this may have been discontinued, but if you do have the CQM check configured in your environment still, this basically just shows you what different measures your CQM check template is configured for. So it's going to show you by provider, all of the different measures that are associated with that template. Next, we have a MIPS risk assessment. So this shows you your potential maximum reduction or surplus from your MIPS payments. So the green items are going to be if you did absolutely perfect on MIPS, you scored in that top 1%, got all of your quality, all your bonus points, all of your PIs were perfect. So it's calculated based off your average fee-for-service payments by year. And then in the blue portion, it's showing you essentially if you didn't submit anything, and we didn't have these current grace periods that we've had for the last couple of years, what the potential impact on your revenue could be from scoring really well on MIPS or to scoring really bad on MIPS. Next, we have EHR tasks over 7 days old. So pretty similar to the EPM outstanding tasks. This is showing you all the EHR tasks by users that are over 70 days old, the oldest EHR task assigned to that user, and then also the amount of EHR tasks over 7 days for that particular user. Once again, if you see, a report like this particular client went over data conversion, so they do have some outstanding items from that. But clinical operations manager utility would be a great way to clean this up. And if you're seeing a lack of productivity out of one of your resources, one of your workers, you can always go ahead and address those issues or go ahead and assign those tasks to somebody that's going to work them. Next, we are going to be monitoring the EHR tasks by outstanding greater than 20 tasks. So this is all of the users that have over 20 outstanding EHR tasks. It's going to show you the quantity of the users and the oldest date of the task. Once again, great thing to pair with the clinical operations manager template. Next, we have the provider approval queue. So this is showing you all of the items in each of your providers' PAQs. It's broken down into the different PAQ categories: documents, notes, images. Obviously, however you configure your PAQ, whatever you have your provider signing off on is going to play into what's going into their PAQ. But it is going to show you the oldest date. It's a great way to monitor the providers that are working those PAQs, and if there is any deficiencies, to go ahead and address those items. Okay, next we have referrals. So this is the open referrals where the loop potentially needs to be closed. So these are all referrals that aren't in that complete status. So we do have orders, scheduled, follow, result received, and obtained here. This particular one could be used well with the document autocomplete utility. If you wanted to modify that thing to go ahead and mark your orders as closed, you could go ahead and do so, and this would reduce that report. It's going to go ahead and show you the quantity of each referral status, and it's going to show you the oldest date of that referral. Next, we have the Rosetta Status, so items in the Rosetta holding tanks over 48 years old, and the date of the oldest. So this is showing you things that may be potentially stuck in Rosetta for whatever reasons, and goes ahead and shows you, identifies those things, and gives you a trail to go ahead and figure out what those things are to go ahead and get them fixed and cleaned up. Unmatched refills, so this is the amount of unmatched refills by provider, the oldest date of that unmatched refill. So it's going to break down, and you can see which providers, for whatever reason, are receiving a large amount of unmatched refills. And then version. So this is particularly useful for system administrator. These next couple slides I'm going to show you here. So this is going to show you the different template versions used in the last year. I know a lot of people are transitioning to 5.9.8.4 this year, and upgrades, for whatever reason, go smoothly or don't go smoothly. And sometimes you have people working in old versions of templates when they should be working in the new version. So this is a way to identify what versions of templates people are using on. If you're on 8.4 and you see a bunch of people using 8.3 templates, you may have something that you want to address here. It's going to also show you the application versions and install dates, so it's kind of a running history of the different applications and upgrades that you've had installed on the system. And then finally, the date of the last medication update, which is always a good metric because a lot of people aren't staying as up to date on the medication updates as they could be. So this goes ahead and identifies the last time the medication update was installed. So really a useful tool for system administrators in particular. Next one, another great tool for template developers and also system administrators. So this is showing you all of the templates that were used in the past 2 months and the amount of instances that they were used. And this is also helpful for upgrades. So if you do have custom templates in your system and you do have a coming upgrade, this is going to allow you to refine exactly which templates are being used, which are the most frequented templates, and strategize your upgrade around the templates that people are using and focus on the ones that are being used rather than, you know, going in and looking to upgrade things that may be a lower priority due to lack of usage. So this is a really great tool, as I said, for system administrators. When I'm doing upgrades with my client, this is something that I have run just to see if it's one that I'm not engaged in their day-to-day workflow, to see which templates that they're using and which areas I need to focus on primarily for my upgrade to make things testing-wise, to make sure things that are working, and then also to make sure that I am bringing forward the most commonly used templates and I am prioritizing the development of those most commonly used templates for my upgrade. Next, this is the average days to complete documentation in the previous month. So this is the average difference between the encounter date and the last generated note. So this is good for monitoring provider productivity again. So if your providers are opening a lot of encounters, doing their documentation, and then, you know, waiting 3-4 days to go ahead and generate the actual note, you're running into liabilities on a few different areas. Obviously, you're going to be, being that those encounters aren't closed out, you're slowing down your lag time, but also if you were to get audited and you do have providers that have a lot of open notes, there is a legal liability on that side as well. So this is broken down by provider and the average amount of time that they are using to close their notes. And the benchmark for this is 2 days. It's an interesting fact. Next is unspecified and new codes. So these are any unspecified codes that are being used by your providers. So it's showing everything in the last year, all the unspecified codes that the providers have used. This obviously affects your billing. A lot of payers will not accept this. I know from my work, CareOptimize does a good amount of coding. We have a few risk coders on staff. So coding is always something that's very important to us in our line of business. And making sure that our providers aren't using unspecified codes could potentially affect quality scores depending on what line of business you're in, but also your claims being rejected as well. So it's going to go ahead and show you each of the unspecified codes and then how many times they've used them in the, I apologize, I said last year, the last 60 days. And that is all of the different reports and the different free utilities that we're going to be going over today. My team member, Jen,